Hey, it's Keith again. It's the Thursday, March 28th, 2019, and I just got back from my pre-op appointment with Dr. Gross. Flew down from Washington, D.C., made a day trip of it, flew down there to their uh, clinic, not where the surgery center is, but their office, and had an appointment. So I just want to share with you guys how that went and kind of some of the things I learned down there. Uh, so South Carolina is where he's out of. Columbia, um, there's a university down there. It's kind of in a university town. The clinic itself is humble, not too flashy, really down to earth people, just friendly. The South is awesome. So went down there. I had an appointment. It was at 12 o'clock. I flew down. I had a really early flight. So I ended up getting in there about 9:30. I was like, oh my God, I just have to wait around. But they're really friendly down there. They just got me in within like 15 minutes. It was like way early. So they ran a bunch of tests. First thing I did was I got a bunch of x-rays. They x-rayed both sides, the good side and the bad side. And then they did something called a biomet scan, which checks out bone density. And the reason that they do that, at least for Dr. Gross, is it affects how they're going to give you a recovery plan. And they're very conscious about your bone strength, because if your bone is not strong enough, they'll still do a replacement or resurfacing on you, but the recovery time is going to be longer, and they wants to make sure that the patients heal properly. So the bone scan is not painful. You basically lay in a bed, and it's like a low dose x-ray. It goes through you, and the images project, and they see how much of these radiation goes through you and determine your bone density. So there's a chart. It goes from like osteoporosis to like good bone density. There's a couple other things they key in. I think they look at your calcium level and vitamin D level as well. So I was fortunate. I had a little bit, I was in the average zone, but a little bit below the median line, but it was still good bone density. So I was able to get the quick, fast recovery protocol. So I had that done, and then I met with a nurse, three nurses. First nurse just kind of just gave me the paperwork. The second nurse that came in went through all the equipment that I was going to have after surgery. I get device help me put my socks on, a little grabber, a sponge to wash myself with, and oh yeah, a special little device help me lift my leg up until it gets stronger. And then also there was an optional device. It was a polar cooler, and it's like basically a little cooler. You put ice water in, and it runs through some hoses and keeps your area of surgery iced down to keep inflammation down. So they went over all that. Then the next nurse came in, and everyone was asking me questions about making sure it was the right hip. Asked that like 5 times. Like I said, make sure they operate on the right side. So the next nurse came in, asked me a bunch of questions about allergic to anything, blood pressure, any medical history. It's a standard recap. And then the third nurse was basically telling me about the surgery, about some exercises I could to do. One thing that was interesting is they don't recommend you going to a physical therapist. And the reason for that is that a physical therapist can cause more damage than good. So they've come up with these exercises that you do yourself, and it limits the possibility of something going wrong. Also, the nurse was telling me about how to wash my area down twice before, and then a big regimen on the pain management, which was like really good because they're really into having all the right prescriptions for handling all the different aspects. And um, Dr. Gross is really into fine-tuning his procedures, at least it seems to me. So they've implemented this new drug that they give you to reduce, or actually they say eliminate, fracture of the tibia. And where the ball goes onto your bone, that fracture is was at one point like 1% cause of failure. So with this new medicine, you take it for 6 months, and it basically eliminates that possibility. Uh, then after that, the doctor came in, very humble man, talked about surgery, any questions, talked about what I wanted to do after surgery and recovery. So basically, you need to take it easy for a while, and then at 6 week mark, you can start doing more work, more like exercising. And 3 months, you're starting to do like a lot of normal stuff you would normally do, but you want to make sure that you don't have any impact until 6 months. And at the 6 month mark, you can go all out. And in 6 weeks, you go in and get an X-ray, and they check out your progress. So it was an easy process. And my next video is going to be the day of surgery, and then after surgery, and then I will have a few more on my path to recovery. So hopefully this video has been helpful for anyone looking to get this work done to themselves, and I'll let you know how it goes. I'm really looking forward to not having any hip pain and getting back to the life that I love. Thanks.